Albeit a rare occurrence, Vasa Previa can affect 1 in 2,500 pregnancies and can be life-threatening to the baby if gone undetected. Joining us with more on a simple and life-saving test is Dr. Matthew Finneran, Assistant Professor of Maternal-Fetal Medicine at MUSC. Thanks for being here.
Yeah, thanks for having me.
So we recently had a guest who came on to tell us that she had successfully had her beautiful child, but she said it almost didn't happen because Vasa Previa was detected during her pregnancy. So what is Vasa Previa?
Yeah, I think to say what a Vasa Previa is, kind of to start, you want to know what normal is. And a typical umbilical cord has 3 vessels in it, 2 arteries, 1 vein, and it's protected by this kind of rubber-like substance called the Wharton's jelly. And so a Vasa Previa, there's a couple conditions that allow those blood vessels to be outside of that protection, and they course through the bag of water around the baby. And in rare cases, like you described, those vessels can overlie the cervix. And that's a relatively big problem. If you don't know that that's there, you can break those blood vessels, and that would be the blood from the baby, which there's not a lot there. And so it can be life-threatening for the baby if you don't know that that's there.
Oh, goodness. So are you saying that a baby could essentially bleed out while still in the womb because of this condition?
Yeah, so it's
a terrible thought.
It really is. And so it's not all bad.
Yeah.
Because fortunately, ultrasound picks up almost all of these. And so when you look at the bad outcomes that can happen with a Vasa Previa, they're almost exclusively contained to the patients where it just wasn't found. And thankfully, with good ultrasound, newer technology, it's pretty rare for us not to find this.
It is. Okay, so when you do go for your routine ultrasounds, this is specifically something, as rare as it is, but this is specifically something that doctors do look for?
Yeah, so every pregnancy typically is going to get an anatomy ultrasound of the baby somewhere around 18, 20, 22 weeks or so. And really one of the critical parts to document is where is that cord implanting? And hopefully it's implanting directly on the placenta. And sometimes we can find a Vasa Previa. So
if you do discover it, then how do you correct it?
So that's a great question. So most of the things in our specialty you can't correct. You just have to diagnose and prepare for them. And so in this case, you just want to know that it's there so you don't accidentally break the blood vessels during labor or prepare for the chance that a patient may labor early. And so I'm pretty straightforward with patients that the data is just not very good of how to manage this. So the highest level, or at least one of the highest levels of data that we have in medicine, is what's called a randomized controlled trial. No data that says what you should do with this. So you're down to what's called expert opinion, which is like, what should we do logically for this? And standardly, most institutions are going to recommend admission to the hospital early, preterm, somewhere around 30 to 34 weeks, to monitor the pregnancy just in case labor might happen. Because if you do have the water break and you do have bleeding, you got to be delivered pretty quickly.
Well, that's what I was going to ask, is when you're diagnosed with Vasa Previa, does that mean bed rest for the rest of the pregnancy? And also, how soon and how late can this get detected?
Yeah, so as soon as the anatomy ultrasound, you can actually see things really early in pregnancy. We like to do those around 18 to 20 weeks. As far as being admitted to the hospital, at any point you could diagnose this. But from a standpoint of what you're trying to do is you're trying to get that pregnancy as far as is safe. And that tends to be somewhere around 34 to 37 weeks.
Okay, so slight lifestyle change just to make sure you don't do anything that could upset what's going on and cause early labor.
Yeah, it's a really good question that I was remiss not to answer. So the bed rest is relatively controversial. And so that's actually a great point to make, because traditionally in obstetrics, there's a whole host of things we say bed rest, and we've said that for many years. But actually, the long story short is that bed rest has never been shown to improve outcomes in pregnancy. And so 2 things that are bad to go together is pregnancy and not moving, because both of those things cause blood clots.
Oh,
And
okay.
what we found is that, hey, we don't improve pregnancy outcomes, and we tell patients to be stuck in bed, which is actually a really isolating experience.
It certainly is. And, you see some of those videos of pregnant women who are doing just massive weightlifting, 8 months into their pregnancy.
Yeah.
So maybe not doing that and the bed rest, maybe finding that happy medium, as we like to say in most
It's definitely activity restriction within reason.
Dr. Finneran, thank you so much for joining us.
All right, thanks for having me.
We're back after this.